Every single day, more news. But you might remember back in May that President Trump issued an executive order calling for a most favored nation's drug pricing policy in the United States. Anyone who has ever had to pay for a pricey prescription knows that American consumer costs can really sting, but the one thing that will always remain true is that things could always be worse. Most favored nations policy is a form of what's called price controls, where the government in extreme cases sets the price for goods and services on the market rather than businesses. On drug pricing, prescriptions are purchased by the U.S. government to be used in Medicaid plans. Adopting an MFN policy means the U.S. will only pay for those drugs whatever Germany, France, Canada, or the United Kingdom paid for them. These nations have socialized or universal healthcare systems. They pay less for the drugs than they are worth. It's an important distinction. And the U.S. picks up the tab. It's not fair. A Florida man pays more for a drug because Germans aren't paying enough. So what do? The Bernie Sanders position, now adopted by Trump, is the most favored nation's policy, and literally everyone working together around the world to undercut the pharmaceutical companies. This is a classic you don't know what you got till it's gone situation. The U.S. is the capital of medical innovation and breakthroughs in healthcare technology. That's why world leaders and healthcare tourists travel to America for their care and certain treatments. Is Big Pharma super profitable? Yeah, of course they are. But they don't just sit around on beds of money. They reinvest it into new research and development. American patients get the best stuff, and they get first access, first in line. That's what's at risk here, and it is a life or death matter, as critics of American healthcare often point out. What the president didn't do is what he does best: negotiate. Hammer U.S. allies into paying their fair share so consumers everywhere pay equal rates for the medicine they need. Now, as a practical matter, is a most favored nation policy actually going into effect after Trump's executive order? No, it's not legal, and it faces huge hurdles in U.S. courtrooms. Congress would have to pass a measure codifying those price controls. While testifying on the Hill earlier this month, HHS Secretary Robert F. Kennedy Jr. told Bernie Sanders that he absolutely would work with him on legislation to do that. We at the Consumer Choice Center want patients to have access to what they need, and cost is a huge factor, but part of choice is having options on the market being developed to choose from, and this would do the opposite. It's the invisible costs of regulation that hit the hardest. Now, politics can be confusing and often make it seem like your options for a solution are A, B, or C, red pill or blue pill. But it's not true. There is more that Congress and President Trump could do here to fight for and deliver for patients. Negotiate. Pressure our allies to do the right thing. Congress could also address the corrupting role of pharmacy benefit managers, or PBMs, who serve as unnecessary middlemen in the prescription market and jack up rates on patients. It's an option that Congress looks to be ignoring in the big beautiful budget bill to crack down on PBMs. We can do better, and patients deserve that. I'm Steven, and you've been watching the Consumer Manifesto.